Hi,
Hi.
welcome to the office. How can I help you?
Okay, I'm here because as I told you, I'm a hairdresser and my job is standing up.
Okay.
And
You're a hairdresser?
Yes.
You've been doing it for how long?
For 20 years.
20 years.
Yes.
Is there a specialty you have? Like, are you doing just cuts or other
Colors?
stuff? Color. So you're spending a lot of time with a client standing.
Yes.
Right?
Pretty much all my time is standing up.
Okay.
This is what it hurts, but mostly it's on this side.
So number one is your left shoulder.
Yes.
And when you say it hurts, what does that mean?
That means that it's like right now, if I can go more than this. Right?
So we're raising our arm out to the side,
Mm-hmm.
and you're start up at the bottom here, please. And let's slowly raise both arms up. Let's slowly, this is called abduction. And as we go up, okay, your right will still go.
Mm-hmm.
Your left is stopping because of pain or stuck?
Stuck and pain.
Stuck in pain. And where exactly is the pain? Here, in the back. Bring the arms down. Where is the pain exactly?
Okay, it's right here and right here.
So as you're raising it up, you feel it here first, you feel it here first?
First here and then.
First here. So what she's describing first, go slowly up. As she's raising, something is catching on the deltoid insertion. So we have the deltoid insertion here, and then this is carrying on into possibly one of the heads of the triceps into the elbow. Okay, I'm just talking out, thinking out loud.
Okay.
All right, that's the number one reason.
Yeah.
And it started when?
This problem started like about 3 months ago.
3 months ago. Were you doing something specific when you felt it?
Yes. Well, when I was, doing my blow dries, yes, I started that the pain was here, but main thing, it was right here before. I was paying for like.
This neck has been shoulder has been more than 3 months.
Oh yes.
Right?
Yeah, more.
So let's
years.
rewind it. Yeah, let's rewind.
Yeah.
When did you first get this shoulder issue?
Shoulder issue, I will say about 10 years.
10 years ago? And was there an injury while you were working, or it was just
No,
life?
my injury just life.
Life. Okay.
Mm-hmm.
Any major accidents or traumas to the shoulder or the neck that you remember? Any accidents, slip, falls?
Well, I remember about 25 years ago falling, and I got hurt right here on this side.
On the right side?
On the left.
On the left side. We're saying more here?
No, higher. Like right there.
Okay, so she's talking about in the mid-back around T11, T12, along the left side, correct?
Yeah.
Are you left-handed or right-handed?
I'm right-handed.
You're right-handed, so cutting with the right, everything.
Mhm.
Holding blow dryer with left, pulling with the right,
Yes.
right? This way?
Yeah,
Or
this way.
this way?
This way.
Reverse.
Reverse. Both.
Both ways?
Yeah, both ways.
Okay, okay. And how long are you on your feet working typically before all of this?
8 hours.
8 hours a day?
Mm-hmm.
Okay. Then when the shoulder started, have you seen anyone for this?
No.
You're just working with it?
Mm-hmm.
Just dealing with it?
Dealing with it.
3 months?
Mm-hmm.
Okay, enough is enough? Enough is enough.
Enough is enough.
Enough is enough, okay. Anything else I need to know about the shoulder?
Mm-hmm.
In terms of, so you're a hairdresser,
Mhm.
you're on your feet, you're using your hands a lot. You had an initial injury about 10 years ago, 8 to 10 years ago.
Mhm.
You had work done on your neck, shoulder, that was fine. 3 months ago, this started acting up where you get to about this point, it hurts and it's stiff.
Mm-hmm.
See?
See.
Yeah. That's number one. Is there anything else? Any other reason why you're here?
Well, yeah, when I walk, even it's everything like on the side. So when I walk, I feel that it gets stuck like all my leg.
It gets stuck,
Kind of like
tight,
tight.
like someone is pulling it or someone is squeezing it. Squeezing. So the whole left side feels squeezed.
Mm-hmm.
You feel it in your hip? You feel it on the side here?
The side, no, it's mostly, yeah, here.
Okay, so does it go along the side? This is the IT band region, the lateral side, or along the back side? Side, IT band. Okay. So what she is describing in terms of this tightness, she's describing the IT band area. And the way I work and go about it, I don't treat the IT band. And what I've seen historically, IT band is usually not the issue. Okay, it's a result of something else.
Mm-hmm.
Now, the IT band comes from where? It comes from the hip. And so we are going to be evaluating your foundation, right?
Mm-hmm.
If the foundation is off, then the muscles and ligaments will be slightly off balance. And if we're standing all day with an improper or a pelvis or foundation that's off balance, what happens to the structures holding it? They get a little bit tighter, and I'm assuming at the end of the day, it's more tight.
Yes.
You wake up in the morning, stiff. Yes?
Yes.
You get on a little bit with the day, you're okay, you deal with it.
Mm-hmm.
End of the day, it's tight again. Wake up in the morning, it's stiff again. And you've been dealing with that morning stiffness how long? Few years, at least.
Yeah.
Yeah, okay. Have you ever had any x-rays taken before coming here?
No.
So you've had work done, but just
Mm-hmm.
whatever else. Okay. Okay. So number 2 is the side of the back, more on the left side.
Yeah, basically more on the left. Yeah, that's right.
What else?
That's it.
Okay, that's a good start. Now, you know what I do here? Who found me? You said your
My son,
your
because
son.
he was giving me massage,
Okay.
So I guess he wanted it to.
He don't want to give you massage no more. That's what it is. He's like, let's find somebody. I don't have to do this. It's every day,
Yes.
right?
Right.
I understand. He told you, or you came on your own?
Oh no, I came.
You
to
came
my
on your own.
own.
Okay, no problem. So the reason I'm asking is we have to figure out what's out of balance,
Mhm.
right? You're coming in here primary with a shoulder issue. Obviously, first thing I do is evaluate spine.
Mhm.
Why? Because we want to make sure all the power and information is going to the whole body, including the
Mhm.
shoulder, yes? So we evaluate spine, we'll evaluate your extremities, all of it, not a problem.
Mhm.
Okay?
Oh, there's one thing I forgot.
Yes.
Yes, I did about, I guess, 5 years ago, because I was having like a very bad pain, so I thought that I had like a lupus or something.
Okay.
So they did a scan on my back. Yes, now I remember. And what they said is
What scan? Who's they?
the doctor.
Okay.
The doctor.
Okay.
Yes. It's they said that on this side, ¿cómo se llama eso? Osteoporosis?
Low bone density?
Yes, but not exactly that. It's like the beginning.
Okay, I got it. And they're saying that there's a potential of low bone density on an
Mhm.
x-ray. Was it on an x-ray
Mhm.
or a bone density scan?
The scan. Yeah, because
Okay.
they put me kind of like in a bed.
You were lying down?
Yeah, lay
Okay.
down.
And they said where was the low bone density specifically starting?
On these two sides, right here. Right here.
So they said it's starting on the right side, yeah? Okay. Now, whenever we hear this typically with low bone density finding on an x-ray, I'm thinking first digestion. So I'm pretty sure there's something off in your digestion. Okay? We'll go into more detail as we go into the x-ray. So I want to see what the bones look like also. And the reason why Gonstead used to talk, Dr. Gonstead in this method used to talk about low bone density and osteoporosis coming from digestion. So when we have low stomach acid, right, and we're not producing enough stomach acid, HCl specifically, We need HCl to get calcium, iron, and B12 out of the foods that we eat. And if we're not getting it out of the foods we eat, what happens? We need to get it somewhere. Are you doing any supplementation or anything like that?
Yeah, I'm taking the vitamins.
You're taking calcium,
and
vitamin D.
Yeah, vitamin D and the 12.
Now there's an interesting, and B12.
Mm-hmm.
Interesting, and those you need the HCl for, right? Okay, you eat meat?
Very little.
When I say meat, beef, chicken, fish, any of that?
Very little.
Very little. By choice?
I don't like meat or chicken.
Okay, why? It's
I
kind of
don't
the
like
the
smell.
taste? The smell and taste. But when you do eat it, you are able to digest it.
Oh yeah.
Okay.
Mm-hmm.
Well, we'll see what we find when it comes to that, okay? Am I specifically treating low bone density? No.
No.
What am I doing? I'm checking, number one, that everything is balanced,
Mm-hmm.
right? Figuring out what's causing your shoulder and the back. And if we see anything related, I will make a recommendation to help you with your digestion. And then whatever you choose to do, you let me know. Okay? Anything else I need to know about you?
No, I think
That's a good start. Okay, can we stand up then, and we're gonna watch you walk and watch your gait. What's this scar from? Because that's where you're saying your pain was.
Yeah, no, but that's
No relation,
No
right? No,
relation.
not related. Whenever we walk, the pelvis should be moving like this. So we should see these dimples kind of going up and down. The first thing I want to mention is very puffy. There's a lot of swelling. I want you to see this. This is swelling, okay? There's something going on here in the sacrum. And if I look from the top, you can see it's slightly tilted on an angle and it's swollen here. I can see the dimple here, but I can't see the dimple on this side. Okay, so something is definitely going on in the tailbone region. As we go up, let's evaluate. This is the bottom. I'm just opening that a little bit. The left shoulder is slightly higher. The right shoulder is slightly lower. And what you can see, it comes from here and right around the mid-back, she tends to twist. And she's twisting and upper body is favoring slightly to the right. When we look here, I'll tie it up this. Okay, let's look better this way, okay? You can see this side a little more pronounced. You can see a little dishing in here, yes? So this should be smooth like this. When we see dishing, that's called dishing in the spine. Dishing usually comes from an injury around T6, T7. And I know you had something going on here. Now, this area, guess what also it controls, Adam? It controls, it's the start of digestion in this area. Okay? That's why I said that. Let me close up the top and let's walk. Alrighty. You ready?
I'm ready.
Let's walk. Caminas, por favor. And you're gonna walk a straight line back and forth. Turn around, please. And you're gonna walk this way towards me. Now, have your pinky toes always been up like that?
Yes.
As-
I was born like that.
You were born like
Yes.
that?
Yeah. And I had you see the bunion?
Yes.
So I had surgery on this one, but not on that one.
When was the surgery on this one?
About 15, 16 years ago.
Okay. All right, keep walking. We gotta check your ankles. Go ahead, walk. The hips are moving. They should. You keep walking. I'm just gonna walk and I'll talk. Turn around, keep walking. This is how they should be moving, back and forth. Okay? Her right wants to do this though. Shifts out. So when you walk, instead of doing this, it does this. I'm exaggerating. Okay? You're coming from where? Where are you coming from?
From Guatemala.
Guatemala? One of my favorite coffees. Okay, so as she's walking, this is what's happening. As she's walking, it's doing this, the right hip. Okay? Going out like that. Walk for me, please. And if you watch also, her left foot externally rotates when she walks. But her left foot seems more solid than her right. You see her left foot turns out and then she pronates in on the inside. One more walk, please. You do see that, right? Now watch her overall appearance, the overall walk. Regular walking towards me. Yeah, so she's holding this whole side energetically as well. Turn around, keep walking, please. Got it. Low body wants to go one way, upper body wants to go the other way. There's a disconnect. We need to reconnect it now, okay? All right, why don't we come over here and go over your x-ray, overall appearance of your spine. And what are some of the things we see first? Okay, just general appearance let's look at. So when I'm looking at, we start with the foundation and the pelvis. We can see that this line, which is the pubic bone, doesn't sit on the crease center, number one. Number two, we can see this obturator, this hole here, is smaller than this. Yes? Now, it doesn't mean it's physically smaller. This is a x-ray. It's a picture in time. So you're standing against the wall, right? You're standing against the wall. They're taking an x-ray. Those beams come out like that. This is telling us, based on the misalignment, it's a projection. Okay, and I'll go through more of the detail here, but I just want you to see, just looking at it, does it look balanced or even? Smaller, bigger. Now, let's continue. I'm going to zoom in. Now, I want you to see this. Look at your tailbone, your sacrum. It's not straight, is it? It's bent. That's an old tailbone injury we're going to see on the other x-ray. But your sacrum here first is bent. So instead of being straight like this, it's bending this way. Do you see that?
Yeah.
And where I'm seeing it from is just down there, almost down in the coccyx. Okay? So I'm going to go through the whole process now. So we have to figure out your sacrum, what's going on down here. We do know that the pelvis is off. Okay. Now, why am I going over all this? Because you come in here for a shoulder. This is a whole building. If the foundation is not level and balanced, sir, then what business we got trying to balance your 18th floor? Makes no sense. Okay. And we'll go deeper into it as to why. So, do you see what I'm showing you thus far?
Yes.
Yes. Okay. Now, let's go over here. We're going closer. Something is off here, okay, developmentally, and I want to show you something. This is your T12. This is L1. These are the ribs. This is the last floating rib, T12. L1, L2, L3, L4. L5, this is your L5. And what your L5, it's called a transitional vertebrae. This is what you do need to know. A transitional vertebrae we have in about 10% of the population. I have, and similarly in my office, about 10% of the population. Normally we should have 5 lumbars. Some people have 4, some people have 6 because of the way it was developed. Okay, nothing good, nothing bad, it's just what it is. Okay, and what this means in your case, there's gonna always be tight, it's gonna be stiff. It's gonna feel that way too. And I'm gonna give you stuff to do. For you, more important is flexibility, not back strengthening. Between the two, we're gonna need to talk about some flexibility, some sort of flexibility stretch program. And what I mean by that, it could be 5 or 10 minutes a day before work, could be 5 minutes at the end of the day. But it's very important. Otherwise, we don't sort this out. This is just starting. Okay? It's important. Do you see that? It's important. You can see, this is supposed to be, you see this piece here? Let's look closer, I want you to see this. These are called the transverse processes here, yes? There's the side of the bone. Hold on, let me get this spine so I can show you. I spend a lot of time on this, guys, because you need to understand. Once you understand, it's easy to fix. Or, easy to get back to balance. Mira, número 5. 4, 3, 2, 1. Número 1, 2, 3, 4, 5. So 5, what's happening on your 5, it's all starting to be part of your sacrum. Here. This piece here,
Mm-hmm.
these pieces, these are these pieces. Okay?
Okay.
And there should be a space in between. There should be a space there. Here. Yours, here you can see it's just becoming one. And I'm just pointing it out to show you because, again, walking and flexibility will be very important down the road for you. This is all part we'll figure out your foundation. The next thing is, if that's the foundation, then you can see 4 tilts to the right. Yes?
Mm-hmm. Yes.
Then what happens at 3? 3 levels out. And then 2 tilts to the left. 1 goes with it. 12 goes with it. 1, 12, 11. 11 comes back. Yes? Comes back to neutral. So I'm showing you these segments in here. They're compensating. I'm sure you were telling me something is tight in here, but what I'm showing you is it's not caused by there. It's coming from lower down. Okay? 1, 2, 3, 4, 5, 6, 7. 6, 7. This is where your digestion area starts. This is what I was showing you there too. Okay? Now, let's continue. So what I want you to see here, this is what's important about your shoulder now. Now let's put it together. I'm getting to your shoulder. It's tilting at 7. 7 is actually the sugar button. 6 is the stomago. 7 is pancreas. I'm giving you major nerve supplies. Okay. Mira, this goes like this. Then it comes back. It's trying to compensate. Otherwise, where would your head be? Over here. And this curve is why your shoulder looks higher on your left side. And what I'm trying to show you is this is the kink that's causing the shoulder. But the kink is coming from lower down. That's all I want you to see in this right now. Okay? Then, again, if the body didn't compensate, the body has to compensate in the neck to bring the head back to level. And that's why you get all this tension up here. And the tension up here, again, is coming from here, which is coming from here. Does that make sense?
Makes sense.
Does that make sense? Perfect. This is a side profile. And what we're looking at here is this. We want to do a posture assessment. A lot of places that do posture assessments, they do a weighted string where the ear lines up with the shoulder, the hip, and the knee, and the ankle. I do it based on the x-ray. And what we do is we start at the lowest lumbar body rotation. We run the line straight up. And this should bisect C7 and C2. And you can see the difference here. It's off quite a bit. And I'll explain what the significance of this is. Okay? This line should go through here and here. So it tells us you carry your upper body, the top half of the building is behind the foundation. If it's behind like this, what are the muscles doing? They're trying to hold it in place. And so you're standing all day off balance, and then you're tilting like this working. Of course it's going to hurt that. Okay? Here's the good news. Your discs are great. You have good discs. They need to be level, but you have good discs. 4, 3, 2, 1. Your discs are good. These are all good discs. These are old compression. You had some old compression injuries. You can see the bone, but the disc held. Okay? Let's continue. Disc held. These are all your old compression injuries that you were talking. Now, as we get here, here's again, fantastic news. Your disc is textbook. This is fantastic. And 2, 3, 4, 5, 6, 7. This is the area that controls even the shoulders, the muscles up here. So again, we have a little tilt here. What's happening here? Número 2, número 3. Número 3 looks like you're starting a little bit of the reverse curve now, because you compensate. You get a lot of popping in your neck. Yeah. And so the idea here is, as we establish this curve, I'll give you basic things to do to start to get this back. We don't want that to calcify there, okay? We don't want C2, 3. This area, 3, 4, 5, this area is part of the diaphragm, breathing, respiration. Okay.
Yeah.
Right. Does that make sense?
Yeah, it makes sense.
So let's go ahead and examine you now. And I wanted to go over that first because I wanted you to see the transition. Because when I start feeling in there, the numbers that it would normally be, the number will be different that I'm going to say. Okay? Let's go have a seat and get started. So she's coming for a shoulder issue. We're looking at the overall appearance of her posture. We can see right here, we want her to sit this way. This should be her regular posture. Okay? Go back to where you were originally for now. And you can see this musculature is more pronounced. You can see dips in, comes out, and then from here it goes to the side and then it curves back this way. Okay? So the whole idea is just showing that there's a little bit of imbalance here. We want to go ahead, we're going to scope her, starting at the base of the neck. And the first thing, 20, 25 points. T6, T7, left side. 20 points. T6, T7. 18 points. One more time. There we go. And right around L2, L3, we're getting 10 points on the left. And all of that is starting from down in the tailbone. Okay? 10 points, left side, S3, S4 even down low. S3, S4, around L2, around T6. Okay? Head down just a little bit, please. Starting at the base of the neck. And getting about a 12-point reading, 10-point reading. And that's right around C3, C4. You get any difficulty with your breath?
Yes.
What does that mean? More on inhalation or exhalation?
Inhalation.
Inhalation. How long have you had that going on for?
For a while.
More than 5 years?
Yes.
Okay. Is it after one of your accidents?
Oh, yeah.
All right. And the reason I asked that is related to what I'm finding here. Okay. Let's go ahead and statically palpate. And head down, please. Head down. Starting at the base. I'm running my fingers down the spine. Right as I get to there, you can see the swelling start at my fingertips. And it gets orange peely right there. And then it goes right into the center. ¿Duele?
Ay, sí.
¿Sí?
Sí.
¿Abajo?
Arriba.
Arriba.
Ahí.
Ahí. Oh, she speaks now. 1, 2, 3, 4, 5, 6, 7. 7, 8, no. 7, 8, 9, 10, 11, 12. Okay, now we're getting down lower. L1. Same thing. Orange peeling starts there. 5. Now, 5 we said is fused, is part of the sacrum. That's number 4. Number 3. Número 2. Número 2 or número 3? 3. Número 2, número 1. 3. ¿Sí?
Sí.
Now, come back slowly. Número 4. ¿Duele?
No.
Número 3.
Ay, sí.
Sí. Número 4.
Poquito.
5. Now let's go down into the tailbone. Número S1. Número 1. 2. 3. No. 2. 2. Now, let's check. ¿Duele?
Poquito.
¿Duele? No. Poco.
Poco.
S2, L3, T7, and now let's check the neck. This is a completely different combo than what I thought. This is good. Sit back for me, please. Let's work on the check the neck. Number 7, number 6, number 5, number 4, 3, 3. 1, 2, 3. Derecho, izquierda. Izquierdo, izquierda. I always get it confused.
Izquierda.
Izquierda. Izquierda, número 3. ¿Sí? ¿Duele?
Sí, duele.
Derecho? No duele.
No.
Can I lift this up?
Mhm.
Let me do the work. I'm going to just do like a baseball style pitch. This is good. It's smooth. This side. Let me do the work. Okay, so the whole thing is catching. This thing, she's got a lot of scar tissue. This thing is frozen here. There's also a biceps tendon that's out there. I'm not going to work on the tendon today. I have enough to start on today. Okay? Let me do the work. Let me do passive range of motion. Passive range of motion versus active. Active, you're engaging the muscle. Passive is ligament. Even doing passive, it's still restricted. This thing is stuck. If it was freed on passive, but it was stuck on active, it would be more muscular involvement to the shoulder, which there is that component, but number one is going to be the alignment and the power going to it. Okay?
Okay.
All right. Are you ready? I talked a lot today, didn't I? Did I scare you a lot?
Yes.
Nah, I'm not here to scare you. I'm here to do my job. Right? My job is
Fixing.
first figure it out, find it,
Okay.
accept it, then fix it. Okay?
Okay.
You ready?
I'm ready, I think.
Okay. I'm going to start on your third cervical first. It's part of the upper cervical mechanism. After third cervical, we're going to come here and do your sacrum. After that, I'll have you stand and walk a little bit. Then we're going to recheck, and then I'm going to see if I need to do the other two for today. Okay? I want you to take a couple of nice deep breaths in. Take a couple of nice deep breaths. I want you to feel the breath. Otra vez. Bueno. Left hand up. Left hand up. Seatbelt time, madam. And the seatbelt is to stabilize everything, to make the cervical adjustment a lot easier, okay? Guatemala. We used to have a group that goes Guatemala every year to do a mission. 5 chiropractors would go down and help.
I have a client that she does that. Indian. I mean, I don't know where you're from, but I'm assuming.
Don't assume, lady. Everybody wants to know where's Dr. Rahim from. I may tell you guys that at the end of the visit. I'll tell you guys where I'm really from. Okay? And maybe people know, maybe they don't. Número 3. Número 3, C3. Just gotta drop that elbow down. That was a great miss. Hands on your lap. Hands on your lap. You're thinking too much. You know what? You're thinking just too much. Hola. Bueno. Come out slowly. That wasn't so bad. That wasn't so bad.
No.
Take a deep breath in. Raise your left arm. Just humor me. Raise your left hand. Raise it. Diferente? I didn't touch anything else yet. And it didn't even crack so loud.
No, it's just
Just raise it up. Que diferente.
No, it's not heavy.
Not heavy. To the side. Por favor. Side.
Yeah, I see.
That's okay. That's okay. But this way is already better. We haven't even touched it yet. Come over here, face down. Boca abajo. Respire. Sáquelo. Otra vez. Sáquelo. 7. Respire. Sáquelo.
¡Ay!
Perfecto. Gotcha. You okay?
Yeah.
You're scaring me. Be careful. I want to do a little more of the third cervical. You can breathe okay there? It's okay? It's okay?
Yeah. Mm-hmm.
Okay, just want to make sure. This one I'm going to use my thumbs. We're doing a double thumb contact. Light. I just want a little more. Chin up a little bit. Perfecto. And we're just setting it. Oh, that was sweet. Gotcha. Okay. I'm gonna have you walk once and come back on the table, okay? And just walk once. Turn around. Taking a nice deep breath. Diferente?
Sí, yes.
Come over here, face down. Now the fun one, okay? Now we got to start working on this foundation.
Oh my gosh.
Bueno, respire. Sáquelo. Otra vez. Sáquelo. Otra vez. Sáquelo. Bueno, otra vez. Sáquelo.
¡Ah!
Bueno, sáquelo. Perfecto. You okay? It's okay. I have a new patient outside. They're going now. No, no need.
Oh my god.
That was a home run, madam. Come off slowly. Hold my hand. Let me just tuck it back in your place. And I want us to see the dimples when you walk now. Walk from your back and forth. Hi! That wasn't so bad, was it? Mira. ¿Diferente?
Sí.
Sí, ¿qué es diferente?
I feel more loose.
Balance?
Yes.
Now we got movement in the hips. Now we got this.
Mira diferencia.
Sí. Sí. What, you think I'm making it up? I know what you're saying, lady. Come on. Have a seat. We did C3, T7, and S2. Unless it was a very specific issue at L2, L3 area.
Oh, look.
What? What are you doing?
I forgot.
What happened?
Look, I'm tying my hair, and I couldn't do this.
What are you talking about? You couldn't tie your hair before you came?
No.
It's pretty cool, right?
Yes.
Do it again just to make sure it's not a fluke. It's not a fluke, right? Now bring your arms out to the side. Little, it's still pain.
Very little,
That's okay.
but
Better. That was pretty cool. Starting at the base, rescoping. Third cervical is clear. T7 is 1 point, clear. More importantly, I want to see what happened around the lumbar. Upper lumbar is clear. Sacrum is, wait for it, clear. All the way back, please. Mira. 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 4, 5, 1, S1.
okay, me duele un poquito.
Poquito. That's the one we adjusted. Diferente?
Sí.
Bueno. Scoot forward, please. Let's check your hips. Open and close. Both of them together. Good. Open and close. Right side only. Derecho solamente, por favor. Gracias. Bueno. Left side only. Bueno. We don't need to work on the pelvis today, okay? Now I'm going to use the machine to start breaking up some scar tissue. I am not adjusting the shoulder today for a very specific reason. I don't want her to be too sore with what I did. We have to get the power on first. Okay, does that make sense? You can handle it, right?
Yeah.
Raise your hand up, arm up, left hand up. Tickle or pain?
Pain.
Can you handle it?
Yes.
That's it. Raise your right arm all the way up. Squeeze my hand, squeeze hard. We gotta do the elbow, posterior ulna. Posterior distal radius. Posterior lunate. Posterior lateral scaphoid. And seed the joint. This hand, please. Squeeze. Posterior humerus, right there. Posterior radial head. Posterior distal radius. Posterior lunate. There you go. And thumb. Go like this 5 times fast. Squeeze my hand. Squeeze. 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 Bueno, diferente?
Diferente.
Okay, have a seat, please. Just want to check up top, make sure. Perfect. Understand what I found?
Yes.
Okay, and so I'm going to see you a couple more visits to help figure it out for you. Do you have any questions?
Do I need any exercise?
At the moment, your homework is simple. Water, walking, and ice. Walking, 10,000 steps or an hour a day, minimum. Yes,
Okay.
walking. You want this to get fixed on its own, you want it to come back to balance, you need to do the walk. You don't do the walk, you're gonna feel good, it's just gonna take you longer. It's your choice.
Yes.
Less
I
visits.
understand.
More walk, less visits.
Mhm.
Okay. Ice, the areas I adjusted, there's gonna be little soreness. Okay? Water, 2 to 3 liters a day right now. Okay? I'm gonna give you one thing for the inflammation. Okay? And I'm gonna give you a test to do for digestion at home. And then we'll talk about it next visit.
Okay.
Sound good?
Sounds good.
Welcome to the office.
Thank you very much.
You're welcome.